Chapter 51 Urinary Disorders. The largest number of urinary tract disorders are caused by UTIs, infections, and these are microbial infections on any part of the urinary tract and can be subdivided based on upper UTI or lower UTI. With urinary aseptics and anti-infectives can be used to help prevent bacterial growth within the kidneys and bladder, though are not effective against systemic infections. While lower doses have a bacteriostatic effect, higher doses actually have a bactericidal effect. Beginning with acute cystitis, bladder infection, these are lower UTIs that are more frequent in females, caused by a wide range of pathogens, everything from E. coli, staph, strep, pseudomonas. And female symptoms can be everything from pain and burning on urination, frequency, urgency, while males usually have prostatitis as well as symptoms of cystitis. Acute pyelonephritis. This is an upper UTI, and again, it's usually female patients, women of childbearing age, older women, as well as young girls. The most common organism involved is E. coli, that has symptoms of chills, fever, flank pain, painful urination, frequency, and urgency. Urinary tract antiseptics and anti-infectives. These are limited to the treatment of UTIs, while the drug action occurs within the renal tubule and bladder, where there is an effective in reducing that bacterial growth. A urinalysis, as well as a culture and sensitivity test, is usually performed before the drug therapy, and these drugs have the potential to cause superinfections. Trimethoprim and sulfamethoxazole. These are used in both acute and chronic UTIs and have side effects ranging from headache, abdominal pain, anorexia, nausea, vomiting, diarrhea, arthralgia, myalgia, as well as rash and itching. Clostridium difficile may also be associated with use. When dealing with infections, we want to assess the patient for any evidence of a UTI or systemic infection. We also want to closely monitor any urine cultures as well as sensitivity tests. Monitor the urinary output and urine-specific gravity carefully. Also, obtain urine culture to identify any infecting organisms before initiation of drug therapy. You should also advise the patient to avoid antacids as they interfere with absorption. You should also inform the patient to increase fluids and take the drug with food to minimize any GI upset. Methenamine. This is a bactericidal when urine is acidic, though usually with a urine pH of less than 5.5. Used in the case of chronic UTIs, and is effective for many pathogens, everything from E. coli, Pseudomonas, and side effects range again from frequency, dysuria, hematuria, nausea, and elevated hepatic enzymes. Nitrofurantoin. This is a bacteriostatic and bactericidal for UTIs and cystitis, and has side effects ranging from anorexia, nausea, vomiting, diarrhea, abdominal pain, urine discoloration, peripheral neuropathy, C. diff, blood dyscrasias, and elevated hepatic enzymes. Fluoroquinolones. These can be used to treat lower UTIs and have side effects ranging from headache, dizziness, and visual impairment. For this reason, we're going to make sure we have a baseline visual assessment before we begin the patient on these. And again, I know you've talked about these before in our antimalarials chapter. Those antimalarials can be useful for a lot of different pathogens, not just malaria. Selective urinary analgesics. These are used to relieve pain, burning sensation, and frequency. Side effects would include anaphylaxis, headache, rash, contact lens, and urine discoloration, infection, cystitis, as well as bladder discomfort and spasms. Urinary stimulants, bothanicol, another drug we've previously spoken about, works to increase bladder tone and detrusor muscles. Used in the case of things like neurogenic bladder as well as urinary retention. It's going to have side effects ranging from GI distress, abdominal cramps, headache, dizziness, flushing, and is contraindicated in the case of peptic ulcers. Urinary antispasmodics. These have a direct action on smooth muscles to help relieve spasms. Used again in the case of neurogenic bladders as well as overactive bladder. It has side effects ranging from drowsiness, dizziness, headache, blurred vision, insomnia, urinary retention, dry mouth, GI distress, and constipation. Contraindicated in the cases of glaucoma, GI, or urinary obstructions. Urinary antispasmodics, antimuscarinics, and anticholinergics. These can also be used to control an overactive bladder. They work to decrease urge and urinary incontinence, and have side effects ranging from headache, dizziness, drowsiness, blurred vision, tachycardia, palpitations, and abdominal pain. For our first practice question, a patient entering the medical clinic has been diagnosed with an overactive bladder. Which medication would the nurse expect to be ordered? That be A, ciprofloxacin, B, phenazopyridine, C, bethanechol, or D, tolterodine? That answer is going to be A, tolterodine. Practice question 2. Which of the following is the reason that patients taking methanamine for urinary tract infections are counseled to drink cranberry juice? That be A, to ensure a brisk urine flow, B, to increase the alkalinity of the urine, C, to decrease the urinary retention, or D, to lower the pH of the urine? That answer is going to be D. We're going to lower the pH of the urine or increase the acidity to hopefully kill off some of that pathogen. Question 3. A patient with a urinary tract infection is complaining of pain with urination. Which of the following would the nurse anticipate the patient's receiving? That be A, norfloxacin, B, ciprofloxacin, C, methanamine, or D, phenazopyridine? That answer is going to be D, phenazopyridine. Question 4. Which medication is indicated in the treatment of hypnotic or atonic bladder? That be A, bethanechol, B, oxybutynin, C, tolterodine, or D, sulfenicin? And that answer is A, bethanechol. And for our final question, a female patient has been diagnosed with a lower urinary tract infection caused by E. coli. The patient has been prescribed nitrofluorotwin. Which information will the nurse include when teaching the patient about this medication? That be A, take the medication with an antacid, B, tell the patient to inform the healthcare provider immediately if her urine turns brown, C, warn the patient not to drive a motor vehicle, or D, teach the patient to crush tablets and open capsules to facilitate the absorption of the drug? That answer is going to be C, warn the patient not to drive a motor vehicle. But anyway, that's all we got for this chapter. I'll see you in the next slides.